Hello, this is Dr. Richard Kaul with NJSR. Today we're going to demonstrate a lumbar facet steroid injection. This is a procedure that's used for the diagnosis and treatment of lumbar facet pain. And I'm going to use this spinal model to demonstrate some of the anatomical and technical features of the procedure. This is the front of the spine. This is the back of the spine. These white elements here represent the intervertebral bodies or the bony structures. These grey elements represent the intervertebral discs, which are the shock absorbers of the back. Turning the spine around, I'm going to demonstrate the lumbar facet joints. These are the small joints in the back of the spine which provide some stability and motion, but which are prone to degeneration and can lead to the onset of back and sometimes leg pain. And the procedure that we're going to carry out today involves the insertion of a very small needle under fluoroscopic guidance into the joint. Once the needle is in the joint, some contrast material is injected to identify and delineate the anatomical regions of the joint. A therapeutic solution is then injected through the needle into the joint, leading to some relief of the patient's back pain. This is the back of the spine. These are the spinous processes. These are the lumbar facet joints which provide stability and motion to the back of the spine. It is these joints that when degenerate can cause lower back pain. The procedure commences with the identification of the correct lumbar levels, and we move the C-arm to the T12 level, picture, and we count down from T12, T12, L1, L2, L3. The L3-4 facet on the left side is identified by the presence of the needle tip. The C-arm is then rotated in an oblique fashion, opening up the lumbar facet joint. Picture, stop. The needle is then advanced under fluoroscopic guidance into the joint. Picture. 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 I need some longer needles. Picture. Picture. The needle is then advanced into the joint. The level below is then addressed using the same fluoroscopic technique. The needle tip is placed over the joint space and advanced under fluoroscopic guidance, picture, into the joint. Picture. 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 Needle. The joint at the level below, which is the L5-S1 joint, is then next addressed. Using the same technique with fluoroscopic imaging, the needle is advanced into the joint space. Picture. 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 Having advanced the needles into the joint space, the stylets are removed from the needles and a contrast material is injected to identify correct placement of the needles. The arthrogram also provides some information as to the degree of degeneration within the lumbar facet joints. Picture. Having confirmed correct placement within the joints, the therapeutic solution, which contains an anti-inflammatory called depomedrol with some local anesthetic, is then injected into the joint space. The needles are then withdrawn from the patient's left-hand side, and the procedure is commenced on the patient's right-hand side. Using the same technique with fluoroscopic guidance, the lumbar facet joints are visualized. Picture. The needle is advanced under fluoroscopic control. Picture. 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 Into the joint space. The lumbar facet joint at the next level is then addressed. Using the same technique with fluoroscopic guidance, the needle is advanced picture, 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 into the joint space. Needle. The L5-S1 facet joint is then addressed in a similar fashion using fluoroscopic guidance. Picture, 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 yeah, 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 yeah. The stylets are then removed from the needles and the contrast solution is injected through the needles into the lumbar facet joints. Picture. Identifying correct location of the needles within the joint space. The therapeutic solution is then injected through the needles and the needles are withdrawn from the patient's back. This concludes the procedure.